All right. On behalf of the Department of Consumer and Business Services, Division of Financial Regulation, my name is Ethan Baldwin, and I welcome you to this public hearing to discuss the division's preliminary rate decisions for 2024 health benefit plans. The division holds hearings on all individual and small group rate filings. Each hearing is generally limited to discussion of the division's preliminary decision and final objections regarding the filing. During this time, carriers will be permitted to defend their assumptions using information submitted in the filing or indicate agreement with the findings. Carriers may not introduce new information or propose new or revised assumptions at this time. When reviewing a rate request, division actuaries consider such factors as recent and projected medical care and prescription drug costs, including any benefit changes, past and future loss ratios. That is how much of every premium dollar goes to pay healthcare claims costs. This is to ensure the requested rate is not projected to trigger federal rebates or payments from other federal programs. Division actuaries also review the recent history of rate changes and the overall financial strength, including profitability, investment income, and surplus of the company, and as well as administrative costs. Division staff must also ensure that the filings meet all requirements of the Affordable Care Act and determine whether or not the anticipated number of enrollees will adversely affect an insurer's financial position. You can review the full rate request for all the companies on our website, www.oregonhealthrates.org. All communication for every health insurance rate change filing, including written answers to all questions asked during the review period, are posted there as well. In this morning's hearings, we're discussing the preliminary rate decisions for HealthNet Health Plan of Oregon, Inc., Providence Health Plan, Bridgespan Health Company, and Regence Blue Cross Blue Shield. We will take a short break after HealthNet and reconvene at 10 o'clock with Providence. Our agenda will be representatives from each company making a presentation and describing their rate requests. Then division staff will lead a discussion about the division's preliminary decision on each filing. And finally, we will accept public testimony. If you would like to make a comment on a company's filing, please unmute, introduce yourself, and make your comment. Comments will also be accepted online through 11:59 p.m. on August 4th. The division will make final decisions about these rate filings shortly after the public comment period ends on August 4th. We'll get started by asking HealthNet to please introduce themselves and explain their rate requests.
Good morning. I'm Doug Hale, the Director of Actuarial Services in representation of HealthNet Health Plan of Oregon, and I'm here to discuss our preliminary rate filing scheduled to impact the first quarter of 2024. The requested rate impact affects 3,110 small group members and that number is pulled as of March 2023. The average requested annual increase is 4.6%. This consists of a range of a minimum increase of 1% and a maximum increase of 12.6%. We have not added any new plans for 2024, but we are discontinuing two options, the P50 0-5 5000 and the P45 4000 plan. They are no longer going to be offered for the 2024 benefit year due to having low enrollment or being very similar to a competing plan after making adjustments for the 2024 AV calculator. For our remaining small group plans, we made small adjustments just to keep plans within the 2024 AV calculator metal ranges. At this time, we do not anticipate any significant formulary changes for 2024, and we are not anticipating any major network changes for 2024, although consumers may provide feedback on our network through our customer service phone number found on our website. This concludes our summary of the first quarter 2024 rate submission.
Thank you. Division staff will now lead a discussion about the division's review of the filing and preliminary decision.
Thanks, Ethan. Hi, this is Tim Hinkle. I'm the primary reviewer of this filing. I see we have a couple of folks here at DFR. I see TK and Tasha. I believe I might turn it over to them just to real quickly introduce themselves.
Hi, yes, my name is Tasha Sizemore. I'm the Life and Health Program Manager for the division.
Yeah, good morning, everybody. TK Keene, Administrator with Division of Financial Regulation.
And Michael Sink, Senior Life and Health Actuary for the division.
We also have Kirsten.
This is Kirsten Anderson. I'm Deputy Administrator for the division.
Okay, thank you. I'll give, since this is the first hearing of the day, I'll give a little bit of a background on, kind of the rate review and some of the overall things that we've looked at. And before I get into the specifics of the filing, so just in case there's any new folks here that haven't seen how the rate review process works, I'll just give a really high level on what we do. So the companies, so right now they're submitting rates for the plan year 2024, and these rates are filed in CERF. CERF is this, kind of this portal that we use that we communicate through with the carriers, and everything within there is public, like Ethan said. So members of the public may get in and take a look at all the things that we look at as well. These filings came in May, a few months back, and in that time we've been looking through and reviewing them. And whenever we have a question to the carrier, we send it through CERF, and so it's right there, publicly available. Excuse me. Or if the carrier has a comment or question about something for us, they go through CERF as well. So it's all public and just it's written right there. And so talk a little bit about the rates here. So how does the carrier determine what the rates are going to be? So if they're targeting a 2024 rate, they have to use their most recent previous year of experience, so their full year of experience. And in this case, it's calendar year 2022. And so they need to take 2022 experience, spending and costs and things like that, and turn that into the 2024 rate. And to do that, they have to make some adjustments. The first adjustment they would make would be medical inflation. We call that trend. That's made up of a couple components. One is just the increasing cost of services, technologies, and drugs and things like that. And there's also changes in utilization. So, one particular service might be used a little bit more, or projected to be used a little bit more in 2024 than it was in 2022. So the carriers make those adjustments. They kind of trend those claim costs up to 2022. And then to 2024, and then they make other adjustments to 2022 is a completely different year than 2024, and so there could be benefit changes, could be morbidity changes, risk adjustment changes. There could be a variety of things that are in 2024 that didn't exist in 2022, so the carriers have to make some adjustments for that. And those are some of the things that we review when we were looking at how they project a rate. On top of that, then they add in administrative costs. And typically, the first portion I talked about, the healthcare costs, that typically makes up between 80 to 85%, sometimes up to 90% of the total premium. And the rest is administrative costs and margin to get put on top of that. So everything I described there is part of what we review. And so we try to break down the review into a couple pieces. We have the data, assumptions, and the calculations. The data, so like in this case, the data would be the 2022 experience and risk adjustment experience, and other data used to justify some of the adjustments they make. Assumptions would be, certain things like, they would assume maybe there would be more people coming into the market or more people leaving the market, and or a trend is an assumption as well. They have to make projections on how much they think costs will increase. So we spent a lot of the review on the assumptions, and then the calculations is just making sure that when they apply the calculations to to the 2022 data with the assumptions that they've given us, that those calculations as they go forward, that those are correct. And so we review all this. We make sure that the final rates are adequate but not excessive. And in this year we had quite a few things that we looked at in particular. So I'll just go over a couple of these things. So like I mentioned already, trend, and there was labor disputes, and there was a diabetic drug, a GLP-1 diabetes drugs that might influence utilization and costs, and so we reviewed that. There was COVID. Well, and what we reviewed for COVID was, do they think the costs attributed to COVID are going to vary much between 2022 and 2024? And for the most part, we really didn't see that many of the carriers expected costs to be significantly different for COVID between the 2 years. There was also there's the Medicaid redetermination and the basic health plan, and so these two kind of have similar actions, but in a different direction. So for the Medicaid redetermination, there's some anticipation that some folks might come into the market, and with the basic health plan, there's kind of this anticipation that some folks might leave the market. And the way that those the movement of those people would impact the rates is, number one, just the health of those members. If those members are significantly more healthy or less healthy than the market, that would change what the rates would need to be. It also changes the reinsurance calculations that we have. If there's more people or fewer people getting reinsurance, or the way that the math would work out, whether the waiver money that the state would get for paying for reinsurance would change as well. So there's some kind of nuance in there. And one other little piece of how that would move is that the cost sharing reduction plans, the folks that are on those plans would be some of the ones that we would anticipate would move around. Michael, do you have a comment?
Yes, I was going to add that just the results of our research and the carriers back and forth on this is the second lowest cost silver plan that is defined by the silver loading and the number of members entering and leaving the market has been determined to be a normal amount for 2024. And that's because the basic health plan will come into play in July of 2024, halfway through the year. And we've are pretty confident that members who are already sick, already utilizing their services, already have doctor's visits, are not going to want to go in and revisit their health plan and completely upend all of their services that they are getting. And that the only reason somebody might notice that this plan is available after they've already gone through an open enrollment is if they change qualifications and they go into CMS, and CMS notifies them that the basic health plan is available. This makes the amount of people coming and going from the plan in 2024 similar to what we would expect a normal disenrollment to be. In that case, you don't go through and aggressively try to reduce the silver loading, which can disrupt the marketplace. We agree with the carriers who say that that is the factor that is most likely to disrupt the marketplace. So instead, you're going to see that impact on the 2025 rates, and a significant number of people that are expected to leave will have they will not have left yet, because we'll be having this discussion in May of 2024 before the plan's even launched. So we'll be having that discussion next year, not this year. Anyway, thank you, Tim.
All right. Yeah. Thanks, Michael. Appreciate that. Let me cover one more little thing that's involved in that we looked at for the rates, and that was Senate Bill 1529. Senate Bill 1529 it adds in the requirement that the plans must cover 3 primary care visits at $5 copay. And so that added a little bit of the cost, a little bit of cost to some of the plans. And so, that was something that was considered. and I guess with that, let me just jump into the Health Net specifics. I think the carrier did a pretty good job of identifying all the components of the rate filing that were relevant and that we would look at. And so I'll just quickly just say here for Health Net that they're requesting a 4.6% rate increase. We reviewed all those factors I just described for Health Net, and for all carriers, but in this case we're talking Health Net. We reviewed those factors specifically, and we determined that all of the assumptions and adjustments made by Health Net for plan year 2024 were reasonable, and so that we proposed to approve the rates as filed. And I believe, I guess, unless anybody has anything else, I'll turn it back over to Ethan.
Thank you, Tim. HealthNet, do you have any additional information or comments you'd like to make at this time?
No additional comments. Thank you.
Great. The division will consider all information from the hearing and making final decisions on this filing. We'll now take any public testimony. Please unmute and introduce yourself. All right, I'm not hearing anyone. So let me remind anyone listening that August 4th is the last day for public comments. They can be submitted through our website, www.oregonhealthrates.org. We'll now take a break until 10 a.m. and we'll pick it back up with Providence. Thanks, everyone.